as we speak. Stand by for confirmation. You are live on YouTube.
Once I get confirmation for Facebook, I will start the broadcast. Amy, stand by, please, for my verbal cue that we are going to start that we are live on the broadcast.
We are live on Facebook.
The event is live. Recording has started.
Thank you for joining us. The event is now beginning.
Hello, parents. Thanks for joining us here at EVMS Pediatrics for our live parent chat. Is it cough, cold, or COVID-19? Tonight's event is being co-sponsored by the EVMS Consortium for Infant and Child Health, or CINCH, based here at EVMS Pediatrics Division of Community Health and Research, as well as our partners at the M. Foskey Brock Institute for Community and Global Health, EVMS Minus 9 to 5, Eastern Shore Healthy Communities, and the Children's Hospital, the King's Daughters. Tonight, we are going to be talking about the differences between asthma, allergies, common cold, flu, strep, and COVID-19. We're going to help you learn to decode symptoms, figure out when to stay home or go to school, when to call the doctor, how to manage chronic conditions like asthma and allergies, and how to work with your school or child care center during this really challenging time. I'd like to start off by introducing you to our chat team tonight. First of all, I'm Amy Paulson. I'm the director of the EVMS Consortium for Infant and Child Health, or CINCH as most people call it, and serve as an instructor here in pediatrics where I focus on pediatric public health. I'm also a mom of 2 kids, and one of whom has asthma and allergies. So like a lot of parents, I'm also concerned and worried about COVID. I'd also like to introduce you to Dr. Cindy Kelly. Dr. Kelly is one of our specialists at Children's Hospital, the King's Daughters, who many of you see for asthma and allergies in the allergy, asthma, and immunology practice, where she also serves as division director and a professor of pediatrics here at EVMS. And like many of you, she's also a mom. Joining us tonight also is Trudy Gelderks. Mrs. Gelderks is the supervisor for health services at Chesapeake Public Schools and a nursing and school health expert, and she's also a mom and a grandmother. And last, we welcome Dr. Dana Ramirez. Dr. Ramirez is an emergency medicine doctor with CHKD, and she's also a member of the Virginia Academy of Pediatrics School Reopening Task Force. So she brings to us tonight expertise in COVID-19 testing, diagnosis, and management, provides some good information to help increase your understanding about COVID-19. And she's also a parent to 2 boys, one of whom also had COVID-19. So all of us work in healthcare. We are all also parents, and we get how this is very scary and confusing and uncertain right now in our communities. It's also sometimes really hard to get good fact-based information on COVID-19, and we are all concerned for our children and families. Our plan tonight is to have a conversation with you and each other, and hopefully give you all information that you need to make the best decisions to keep your kids and your families as safe as possible. Many of you have been great, and you sent questions in ahead of time, so thank you. We're going to start off by taking those questions first. And whether you are joining us on Facebook or YouTube, you can still put your own questions in the comment boxes that we'll do our best to work in as we go along. We'll also be posting a lot of links to good resources in the feed to those different platforms to answer questions that you might have. If at any point you're having trouble viewing the webinar, we really encourage you to try one of the links to one of the other platforms. Let's go ahead and get started. First, let's start off talking about common symptoms of asthma, allergies, common cold, flu, strep, and COVID-19. Dr. Kelly, can you help us understand the symptoms of these different conditions? What are the different symptoms? How are they different, similar?
COVID-19 in children, which some things are similar to adults, but some things are more individualistic. Fever is quite common, more common in adults than in children, but certainly a very important sign. Fatigue, cough and sore throat are common, shortness of breath, also headache and muscle aches or body aches. A symptom that's fairly unique to COVID-19 is a loss of sense of taste or a sense of smell, congestion or runny nose, gastrointestinal symptoms such as nausea or vomiting, and also diarrhea. The gastrointestinal symptoms seem to be more common in children than adults, but again, there's a lot of overlap between these symptoms. And this, I think, is a wonderful chart, and it leads us to really the major point, one of the major points we're going to try to get across tonight. You can see that down the symptom column are all those symptoms that we've talked about, and then you look across the top, and we've listed diseases that can sometimes mimic similar symptoms to COVID-19. If you see flu, almost every box is checked, the same as COVID-19. Influenza is also a viral infection that occurs this time of year, and we'll talk a little bit about that, but certainly one of the reasons we're going to stress it's important to get your flu shot. Upper respiratory infections like cold, everyone knows they can present with cough, sore throat, fatigue, runny nose, body aches. Strep infection is the one that tends to have fever more so than upper respiratory infections, allergies, or asthma. But again, sore throat, GI symptoms are common. And then the last two areas, allergies and asthma, cough can be very prominent in those two disease entities. Sore throat, obviously shortness of breath, fatigue, and runny nose, especially with allergies. So what I think you can see and clearly take away from this chart is that there is significant symptom overlap, and it's often difficult to differentiate between any one of these disease processes in COVID-19.
Great. Thank you, Dr. Kelly. Really, so again, the main message here is that it's very hard to tell the difference, and that parents should suspect COVID-19 is a possibility even with very mild symptoms in their child. Is that right?
That is absolutely correct. We know that even up to 40% of people can be asymptomatic, not show any symptoms at all, and still have COVID-19. Some patients, as I'm sure you know, have very mild symptoms. And again, they don't need to have all those symptoms that we listed for COVID-19. They may have a sore throat and a runny nose, and it is sometimes indistinguishable between upper respiratory infections or allergies.
Right. Dr. Ramirez, could you tell us what a parent should do first if their child has symptoms, and help us understand when and where a parent should seek out testing?
Absolutely, good question. Thank you for everyone joining tonight. It's nice to have the community involved and interested in learning about this. I think that one of the most important things to do after making sure that your child is well, is safe and well, if they have symptoms, you need to keep your child home and you need to notify the school. So that's the first two steps. Once you've kept your child home and be able to notify the school that your child has symptoms, you want to go ahead and schedule an appointment with your child's healthcare provider for evaluation to determine if the symptoms that your child has are COVID-19. Could they be from another reason, such as Dr. Kelly just went through all of these overlapping other processes that can potentially be causing their symptoms, such as cold or flu. And then the question about when to seek out testing is actually a little bit of a complicated question. And I think we've probably all heard a lot of mixed messages out there. Times where we definitively recommend that somebody get tested would be any child who's had a known exposure to someone who is positive for COVID-19. So what we mean by exposure, the definition by the Centers for Disease Control, or CDC, is an exposure is when a person is within 6 feet of somebody with COVID-19 for 15 minutes within a 24-hour period of time. So it doesn't have to be 15 minutes continuously. It can be 15 minutes that is split up into smaller blocks over a 24-hour period of time. And this is regardless of whether either of the two parties, that one that's infected or the person who's been exposed, is wearing a mask. So in those instances, we want somebody to get tested for sure. In other instances, there are lots of variabilities as to what the correct timing is for testing or whether somebody even should be tested or just observed. It depends a lot on what the availability is of the test in the particular region that you're in, what the viral load in the region that you're in is at that time, meaning how much virus is in the community. There's a lot of other things that can factor in, but your healthcare provider can help you sort all of that out, and so making that initial appointment really becomes the most important piece.
So with the other tests that they should expect, what should they expect besides the COVID test when they go in to see their healthcare provider? How can we be sure what is causing the symptoms that they're having?
So frequently when we see children after they've developed symptoms, the testing is directed at some of the specific symptoms, so certainly sore throat, looking at a strep test. But because of the degree of overlap that you again saw with Dr. Kelly's previous discussion, one of the things that we frequently will send is something called a respiratory panel, and that looks for a lot of different types of infections. So it can look for something called RSV or respiratory syncytial virus. It can look for other viruses that cause the common cold. Certainly, we can check for influenza, we can check for COVID-19. So there's a lot of different tests that'll be likely done depending on what symptoms the child's presenting with and and also what situation they were in, was there a known exposure ahead of time. The difficult part with that, or the second part of your question, how can we be sure what's causing their symptoms, is the hardest one, because unfortunately we really can't be completely sure what's causing their symptoms. We have been seeing that there is some overlap where some children will have two infections concomitantly, so you can get COVID-19 and influenza at the same time. You can have strep and COVID-19, you can have influenza and strep. And so given that situation, as well as the fact, and I would love to talk about this a little bit more at some point, that the tests are not always completely perfect either. We can have somebody who tests negative for any of these diseases and still has the disease. And so we are 100% sure. We use our clinical judgment, we use the history and talking with the family, and we use the tests that we have available to us to try to make that determination.
So in speaking about the tests, let's talk a little bit about the COVID-19 tests themselves. So we've heard a lot of sometimes confusing information on the different types of tests. So what are the tests and what do they tell you?
That is a great question. So let's start with the fact that there are new tests coming through the FDA every single day. And so a lot of the reason why you hear so much differing information is because it does change rapidly and it changes frequently. That said, I think there is a way to simplify it enough to kind of understand it at a more basic level, which is that there are viral tests and there are antibody tests. And so viral tests to see whether or not you currently have an infection with COVID-19, and your antibody tests essentially test to see if you have antibodies in the bloodstream, meaning that you were infected previously with COVID-19. And so those are the two main types of tests that are out there. Now, when we go to the viral test, there's actually two separate types of viral tests. So there are the PCR tests, which is what most of us think of as the nasal swab, but there are other types, such as the saliva test that you may have heard about more recently. And then the other test is what's called an antigen test. And an antigen test looks for a protein that's on the outside of the virus. And that antigen test can frequently be done faster and it can be done less expensively, but it is generally less accurate than the PCR test, which takes a little bit longer and can be more expensive. Again, having said that, there is development of some more rapid PCR tests coming out, but this is a pretty broad view of what we're talking about. Now, the difference between the two is that your PCR test, or that one that generally we all think of the nasal swab, actually amplifies a piece of material that's in the virus. And so if you have a very, very, very small amount of the virus in your body, that test can amplify it and then detect it. And so it can show that you're positive a lot earlier than that antigen test, which can't amplify it. It can't actually grow the protein that it's looking for. And so one of the things that we see is that somebody with the PCR test you could have an antigen test that shows negative and a PCR test that shows positive because of the level of virus that's in your system at that point in time.
So one of our viewers has asked if doctors' offices give antibody tests. Is that the place to go if you're interested to see if you have had COVID-19 in the past?
The doctor's office can order antibody tests. They're actually not that difficult to obtain anymore as they were maybe back in March, April, and May when we were all kind of learning a lot more about this. So they can be ordered by your physician. I'm sure Dr. Kelly orders them in her office sometimes. They can be done at some of the urgent cares around the area. So there's a lot of different options for getting an antibody test. But the one thing to remember, if you do have an antibody test, we are seeing that there's the possibility of being reinfected with COVID-19. So there is some thought that having a positive antibody test means that you have some degree of protection for about 90 days. But that after that 90-day mark, you may not be protected any longer. So it doesn't necessarily give you free rein to be exposed to everybody else who has COVID-19, meaning, oh, I've already had it, so I won't get it again. Unfortunately, that's not the case, at least from what we know to this point in time.
So when we hear, a parent actually asked prior, what does it mean when we hear people talking about false positives and negatives for tests? So you kind of alluded a little bit to that just a minute ago, but if you could just sort of tell us a little bit more about what it means to have a false positive or a false negative.
So false positive is really not as much of an issue as it may have been at the beginning because our tests have gotten a lot better. And so when the accuracy has improved, and when we get a positive test, most a positive test. Where we do have some issues still are with negative tests, particularly with the antigen test. So as I mentioned before, early on in the disease, you have a very low level of the virus in your system, and maybe your body fights it off and you never get a higher level in your system. And so some tests, such as the PCR test, might be able to detect that. It could even be early enough that it can't detect it, and then you'll get a negative. And then those antigen tests that we talked about that are generally a little more rapid and a little less expensive, they can't detect it as early as a PCR test is. So I'm going to give you a concrete example, which I experienced with my son. My son was at college and was exposed, had a known exposure on a Saturday. So he was with somebody on Saturday. On Monday, that person called him and said, I have a fever and I got a test and it's positive. So he said, okay, it's been 2 days. I'm going to go get an antigen test. So he went and he got the rapid test done. His test was negative. He called me and said, great, I'm negative. I don't have to worry about it. And I said, oh, no. You need to sit in your room and wait. And you need to not go anywhere and see what happens. Well, the following day, he had symptoms. He developed a cough. And then the next day, he developed a fever. And he went in and got a PCR test, and he was positive. So my point being that he probably was developing the virus before he was able to test positive with that antigen test. So that's really what we mean by a false positive, meaning somebody has the disease and it's at a very low level that it hasn't been able to be detected yet, whichever test it is that they're getting.
Sure. And with COVID, people are actually contagious before they have symptoms. Is that correct?
Yes, and what's really interesting and has made this particular disease very difficult for all of us is that they're infective up to 5 days is what we believe at this point in time based on the science that we've seen before they ever show symptoms. And we know there are some people who never show symptoms and had an asymptomatic infection, but those that show symptoms can still be infective up to 5 days before they have a single symptom. Whereas with influenza, it's generally 24 to 48 hours from when they are able to infect somebody else until they actually show symptoms. So the period of time that you could possibly infect another person before you know you have it based on symptomatology is a lot longer with COVID-19 than it is with flu, for instance.
You kind of alluded a little bit with your son who was like, I got the negative test, I'm good to go. And you're like, no, wait. So sometimes when we take the test, some come back more quickly than others. And so sometimes the tendency is to kind of go out and go about your business. So what should a parent do with their child while they're awaiting a test? Is it okay to go about their normal business if a rapid test for COVID, flu, strep has come back negative, but they're still waiting on the results of maybe different types of testing that take a little bit longer. What should a parent do?
So it's a little bit of a tricky question, but I think, over time we've sort of sorted out some recommendations based on the science that we have at this point in time that are reasonable. As far as flu and strep go, the test should come back relatively quickly. The parents can follow the advice of their healthcare provider, just as we've done years previous to this one, which is generally, looking at 24 hours without fever or symptoms that are improving, and they can generally start to go about their business again. But with COVID-19, a lot depends on the suspicion of whether or not we think the person has it. It depends a lot on whether or not there is a known exposure. And it depends a lot on what the child's presenting with and whether there's any other plausible, reasonable explanation for the symptoms that they're experiencing. So what we look for is if a child is suspected, so we see them and we evaluate them, and our medical evaluation makes us think that this is really a likely COVID-19 infection. Or if we talk to the child and the family and we know the child has been exposed to COVID-19, so they've definitely been around somebody, then as mentioned previously, a test can be negative early on, and that does not change the recommendations to keep somebody in isolation or in quarantine, depending on whether they're positive or not. We can get into that, but I'll use the word quarantine for now, meaning we would tell the child they need to stay home until they are without symptoms, their symptoms are improving, they've got 10 days from the time they develop the symptoms, and they have 24 hours without fever. So it's a pretty extended period of time that we need people to stay home, because they're able to infect others during that period of time if it turns out to be COVID. Long story short, negative test does not equal go back to everything that you want to do. It equals you need to still stay home until we know for sure that this isn't COVID-19.
Right. So you mentioned earlier, isolation and quarantine, and we all hear, like, a lot of people using those interchangeably, but they're really different. So if you could kind of tell us, what is the difference? Do families with kids who have even mild symptoms need to do this? What about when other family members have a possible exposure, or if other family members have tested positive? What do you do? Should parents also keep kids home? How long? What's the difference?
Great question. I think everybody confuses isolation and quarantine, including those of us in healthcare interchange them sometimes. But to define it, isolation applies to a person who has COVID-19. So we're going to isolate somebody who has been infected. It means separating a sick person with a contagious disease from people who are not sick. So that's what we use the word isolation to mean. Quarantine applies to someone who's had a known exposure. So a known exposure to COVID-19, and then it means separating or restricting the movement of the people who are exposed to a contagious disease while we watch to see if they become sick. And so this was used, quarantine was used back with plague. It was used with the Spanish flu 100 years ago that we all talk about now, since we haven't seen a pandemic in that length of time. Essentially, when you quarantine somebody, you take somebody that you know might have been exposed and you get them away from the rest of the population until we're certain they're not sick. So how do we apply that to COVID-19? Well, if anyone in the household tests positive for COVID-19, the person who is positive has to be isolated for 10 days. So isolated, meaning they're the sick person. We want to keep them from anybody else. And they need to be isolated for 10 days from the onset of symptoms. Or if they didn't have symptoms, from the time that they had a positive test. And then they need to have 24 hours fever-free and symptoms that are improving in addition to the 10 days before they can come off of isolation. Now, for everyone else in the household who therefore are considered exposed, because if you're living in the same household with somebody who has COVID-19, you are going to, in all likelihood, have been within 6 feet of them for more than 15 minutes in a 24-hour period. So once we've met that definition of exposure, they all need to be quarantined. And when you quarantine, we ask that people are quarantined for 14 days. This is the recommendations from the CDC and from the Department of Health. So 14 days from the date a household member that's positive first had symptoms or had a positive test. And this doesn't really change if the symptoms are mild, moderate, or severe. It's the same regardless of the severity of the symptoms. So the one thing I do want to point out, I know this seems counterintuitive because what I just told you was that the person who has COVID should be isolated for 10 days and the person who is exposed should be quarantined for 14. So we're actually telling you to keep the potentially healthy person away from others for a longer period of time. But this is because of what we discussed before. You can be contagious up to 5 days before you show symptoms or test positive, and you can be spreading after that. And so the period of time that the exposed could potentially become positive is longer. And that's why we end up in that particular instance.
Right. So let's talk a little bit about kind of how we plan. Dr. Kelly, you and I had talked earlier about the importance of kind of developing a plan for the coming months. And so what kinds of things should families think about for keeping their kids safe or preparing for illness?
So, first of all, I think in terms of planning mitigation strategies that everyone is well aware of in terms of wearing a mask, washing your hands, and social distancing, I think can't be overemphasized. The issues in terms of when we're specifically speaking about patients with asthma and allergies is everyone should have an asthma action plan. This is now such an important time to follow your asthma action plan. You have controller therapies. You should be using them routinely. This is not a time to forget to use your controllers. You should be using your spacer device. If you have known allergen triggers, if you know that every time you go to see grandma who has a cat, your asthma and allergy flares, then, make sure that you take your medication ahead of time, or maybe just, avoid triggers such as pet dander or dust mite that may trigger some of your symptoms. And then beyond that, we recognize that, school systems are going to be certainly vigilant about monitoring for either symptomatic patients or families where siblings have become symptomatic and they may have to be home in quarantine. So it would be important to make sure that you have childcare available or think about that ahead of time. Make sure that people are well familiar with using internet access to go virtual, and making sure that you have enough medication at home to take care of your child, antipyretics like Tylenol to treat fever, fluids in case there are GI symptoms, those kind of things, which can be symptomatic, obviously, of flu or COVID.
Right. Let's talk a little bit more about schools and childcare now. Mrs. Gelderks, we're all kind of used to kids having a bit of a runny nose and such during these fall and winter months. And most of us know that if our child has a fever, they should always stay home. But a lot of kids do go to school with cold symptoms during kind of normal years. But this is really anything but a normal year for sure. So get to tell us a little bit about, just generally speaking, when should parents keep their kids home from school or childcare during COVID-19?
Sure. It's definitely a very challenging year. Because the symptoms of COVID are so similar to other illnesses like colds and flu. If the child has close contact with someone with COVID-19, then the child must stay home in quarantine, as Dr. Ramirez was stating, for 14 days from the date of their last contact. The trickier part is what to do if a child is sick, especially because the symptoms of COVID-19 are the same as the symptoms of other illnesses, including the common cold, influenza, gastroenteritis, stomach bug. So parents and guardians know their child and are best equipped to recognize whether these kids' symptoms are normal for them on that particular day. So for example, a child that has allergies or asthma might have a cough or runny nose every day, even though they're not contagious. So if the symptoms seem worse than normal for the child or are not of any unusual concern, then the parent or guardian are encouraged to manage the symptoms the way they normally would. This does not apply, though, if the child has a fever. A child that has a fever should not go to school or to the child care center. However, in the absence of a fever, Parents or guardians might choose to keep their child at home, contact the school health advisor, discuss it with them, and then depending upon the child's symptoms, either monitor them, refer them to their primary care. But again, it's incredibly important to make sure that your school nurse is kept up to date.
Great. Kind of a follow-up question that came in is one of the parents asked that, sometimes a cough from a cold can linger for weeks and have some residual cough, and wanting to know, are they supposed to keep their kids quarantined for 14 days after the cough ends, even with no other symptoms? So, Mrs. Jelders, I don't know if you want to take that or one of our other docs here.
Go ahead.
Well, I would say if the cough persists for 2 weeks, they need to be seen by their healthcare provider. It could be COVID. It could be untreated asthma. I mean, this is a very common time for asthma to flare with weather changes. So I think it would be very important for them to see their healthcare provider to try to ascertain what the cause of the cough is. And my guess is nowadays that most providers, especially in our current climate, with the incidence of COVID and the rate positivity rate climbing astronomically, that they would really need to have a COVID test, I think. But if you have a persistent cough like that, you should be seeing your healthcare provider.
Right. We have another comment? Okay. So back to you, Mrs. Jelders. If we could talk a little bit about how schools and daycares make decisions about when to send kids home during COVID-19. What should parents expect?
Sure. So really the partnership between the families and the schools is so incredibly important. We're asking that our parents and guardians answer 2 questions every day before they even send their child to school. Has your child been close to somebody with COVID-19 in the past 14 days? And also, is your child sick? If your child has answered yes to either of these questions, we're asking you to keep your child home, speak to your healthcare provider and school health advisor. And in school and daycare, child care personnel need to be notified if the child will not be attending that day. If the symptoms are new or different for that child or concerning, then the child should be kept at home. I think it's incredibly important also to consult with your child's healthcare provider if there are any symptoms or anything that's different with what they normally are experiencing, or if they demonstrate any of the additional symptoms or have had any exposures.
Right. And so here's another big question that a lot of parents are asking. What happens at the school level when the school is notified that a student or a family member is tested positive?
Can you repeat the question? I'm sorry.
Sure. What happens at the school level when the school is notified that a student or family member tests positive?
So that's a really important question to go through. And the reason is because the most important question or concern for a lot of families is HIPAA. HIPAA is the Health Insurance Portability and Accountability Act, and it protects sensitive patient health information from being disclosed without the consent or knowledge. This ensures that health information is properly protected. Schools have communication plans that describe the flow of information when addressing COVID-type issues. So knowing what your school's communication plan is gives you a better understanding. But the one important thing to know is that there's a strong coordination of information and the communication flow, but at no point is your child's information communicated. The only person that has information specific to your child's health condition is your school health nurse advisor. The nurse and myself, of course, at Health Services, we have that information, and we communicate only by providing basic information such as the information of whether or not there's a positive case in the school, who needs to be communicated with at the school, and who needs to be communicated in regards to the bus. But at no point is that person's individual health information relinquished or the student's name.
All right. So if somebody in the family is positive, let's say a student or a family member tests positive, should the parent call the school right away, or should they just, we know that the health department is also doing contact tracing, and is the health department going to call the school? Who's going to do that notification? What's the best way for that to happen?
The absolute earliest the school can be notified, the better. The quicker we can identify potential risks in the school environment, is going to minimize the risk at the school level. So staff of the school or child care facility play an important role in supporting the health department efforts in obtaining this information. Similar collaborations occur routinely for cases and contact investigations of other communicable diseases and would be expected to continue seamlessly for COVID-19 investigations as well. So collaboration with, for me, the Chesapeake Health Department is key to minimizing the risk in the schools and monitoring the epidemiologic links in the particular school. So as a reminder, your information does remain confidential unless you choose to share the information with others. So we will be working very diligently to make sure that anybody that potentially has had close contact will be identified and make sure that they're communicated with, and that anyone else that may be not a close contact will also be aware that there's been a positive case or an exposure that has occurred at the school.
Right. So we know that there's sometimes kind of a gap between when somebody, finds out that they're positive and that information maybe gets going through the health department. So would you prefer that parents go ahead and let you all know right away so that you guys can get going? That's the recommendation for you guys to go ahead and have them all?
Absolutely. The earlier the schools get notified, the better. And again, reaching out to your school health advisor, your nurse, your school nurse, is the key. We will maintain the confidence of our individual and make sure that the information is handled as expeditiously as possible to ensure fewer people are exposed or people are identified much quicker.
Great. Dr. Kelly, I'd like to come back to you for a bit. So one of the big questions that we've gotten, you kind of alluded this earlier, is, what to do about asthma allergies during COVID-19. So, many of our kids, like my own, struggle with symptoms this time of year. And we know that this is kind of not the time to be having those symptoms. So it's a really important time to make sure that we're really monitoring those allergy and asthma triggers, and that because they can be so hard to distinguish between them and COVID-19. Talk a little bit about common triggers. So are there any other things that parents and kids can do to keep asthma and allergy symptoms at bay right now?
Yeah, so I think as we said, I think it's really important to follow your asthma action plan. If everyone doesn't have one, I would encourage them to get one from their primary care provider or their asthma or allergy specialist. It's important to maintain those medications. It's important to use your allergy medicines routinely, whether they're in the form of nasal sprays or oral medications. And then avoiding triggers and wearing a mask. Wearing a mask can not only keep you from getting COVID, but it keeps you from getting other viral infections, as Dr. Ramirez was talking about, RSV and enteroadenovirus cold that cause common colds. And those can trigger asthma and allergies as well. So it's important for two reasons.
Right. And so let's say a parent has a child that is having an asthma exacerbation or allergy flare with symptoms. At least that's what they think that it is. Who should they call, their PCP or their specialist?
So I think that really depends on the family. Some are better, some of the kids who are more severe tend to see their allergist or their pulmonologist. Some of the more milder, kids with milder symptoms may want to see their primary care doctor. And the thing I would also mention is that at CHKD, we are actively doing telehealth visits. So although it's very really safe to come into any CHKD clinic or primary care office or the hospital, there are many rules and regulations we have. Everybody has their temperature taken. Everybody is wearing a mask. No one waits in the waiting room. We move them quickly so that they're in their own patient room. There are a lot of safeguards to prevent possible spread within the CHKD system. That being said, almost all the providers at CHKD are providing telehealth visits. So if you have concerns and you either may not be able to make the time or you're home taking care of some other sick child, just call your provider and try to arrange for a telehealth visit. It's obviously sometimes not absolutely as good as being there in person, but the pediatrician or your subspecialist can get a lot of information and try to guide you in what to do and how to treat your current symptoms. And they can even make arrangements put in an order if they think a COVID test is required. They can go ahead and put in that order, and then you can go to any urgent CHKD urgent care and then get the test.
Right. You know, we hear a lot of parents being afraid to go in, but what we're trying to tell people from our end is that, you know, we want them to see their specialist for their maintenance visits. We want them to see their doctor for their well child visits. So the message here, I think, is that they should not skip those well child visits, those well child vaccines, their specialist maintenance visits that we want them to come to get those visits, and that is very safe for them to do so.
Absolutely, and get their flu shot too.
Right. So speaking a little bit, yeah, Dr. Ramirez, you wanted to add something?
I'm sorry, that was just my emphasis to please get your flu shot.
Yes, absolutely. Yeah, absolutely. I think one of the things that I know that we've all been discussing is that, you know, this is, we always want you to get your flu shot, but this is not the year to skip the flu shot, especially as we saw earlier, the symptoms are very similar. So if there's any way that we can keep you from getting that or getting both COVID and the flu at the same time, we certainly want to do that. And the flu vaccine is safe and it is effective. And in particular, it's effective for making sure that children don't die from flu. And that's been pretty well substantiated. Even if you're unlucky enough to still get a case, it'll be milder and you're less likely to have a fatality from flu for a child. Going back to asthma a little bit in the schools, Mrs. Gelderts, you could just kind of tell us really quickly, if a child has a chronic asthma allergy symptoms and working with their school, what should they be doing around communicating those symptoms, and do they need to rule out COVID-19 every time they have one of their chronic disease symptoms before they return to school?
So due to the current pandemic, this does bring the challenges for schools. But children with moderate to severe asthma are also going to be at higher risk for complications from COVID-19. So parents may be struggling with the decision to send their kids back to school or not. But schools are working with parents to consult with their child's healthcare provider to address those concerns and definitely develop a plan. When you're preparing for your students to return to in-person learning, because I know we have students already in Chesapeake and we're all at different stages throughout the Hampton Roads market. If you're still at the point and where you're planning for your in-person learning, there may be questions about how school administrators, nurses, teachers, and staff are managing the effects of COVID in their school and how this may affect your students with asthma. Addressing asthma management in the school can help establish an environment that supports both the learning and the safety for your student. So be sure to work with your child's physician to obtain an asthma action plan, provide the necessary medication to your child's school nurse. If they have life-threatening allergies as well, provide that LAMP, life-threatening allergy management plan. It's also incredibly important. These will ensure that the needed medications will be available when they're required. And remember, the earlier the intervention, that promotes a safer outcome.
Right, great. Let's talk now about what happens if a child is sick or seen by a doctor. Are there forms that need to be filled out? What do we do? Dr. Kelly, could you talk with us a little bit about what the permission to return to school or child care form is all about?
Sure. So I think Amy has a picture of it. It might be too small for y'all to read, but it is available to all the CHKD physicians, and frankly, it's available online to anyone if you go to the CHKD website. And basically what it does is it gives different scenarios, and it really allows the physician to express what they think is going on with the child and what the risk factors are in terms of exposure to COVID, whether or not they have, for example, someone who's had COVID, whether or not they've completed their isolation. I don't know if all schools, but certainly many schools will require some sort of validation from a pediatrician or a primary care provider that says, yes, they were diagnosed with COVID, yes, they have been at home and it's been 10 days either since their first symptom or since their positive test. It also gives scenarios that say, I've examined the child, they do not have COVID, and they are cleared to return to school. So it's available online. It's very helpful, and I think it's extremely helpful for the school nurse because it's a direct communication between the child's provider and the school nurse, and it makes very clear to the school nurse what has happened with that child and what, when it is they can come back to school safely.
Right. Comes down to communication, making sure that we are communicating and have good information, both from the healthcare provider's office and back to the school or child care setting. So talking about kind of going to school or child care, or even just out in the community, a lot of parents are also worried about their child wearing a mask. So Dr. Ramirez, can you tell us some about, mask, how and why a child should wear one, tips for wearing one? Is it okay to just keep it over your mouth and breathe through your nose? Odors, bandanas, those types of things.
So there is a lot of information out there on masks these days. So if we can, I'll start with this graphic in front of you, which is the basic of how to wear a mask. So I think we see a lot of people with masks that are kind of right here underneath their nose. It certainly doesn't work as well if it's not covering your nose. It doesn't work at all if you're using it as a chin strap or a headband. So just that image over there on the left, you want it to be snug fitting around the nose and then to also fit underneath the chin. And that's the most important part of how to wear it. So if we could talk a little bit about the recommendations and why we're wearing it. We have, as we've done increased studies and we've had more and more data and scientific facts come in terms of mask wearing, we do know at this point in time that I'm going to start with the fact that we know that COVID-19 is mostly spread through respiratory particles, and so that's what we're trying to protect by putting a mask on. What we have learned as we've done this testing is that at least 50% of the particles expelled from the mouth are blocked by wearing a mask that fits well and that has at least 2 layers of a tight woven material such as a cotton. And if that's the case, we can block, sorry I keep putting my hand in front of my mouth, but we can block particles, at least 50% of them, and in some instances, depending on the type of mask and the way it's worn, up to 80% of particles. The other thing that we've been more recently been able to demonstrate with scientific studies is that there is some benefit to the wearer of the mask as well. So for a while, I think, a lot of us were hearing that the only benefit, which is still quite a benefit, but the only benefit to wearing a mask was you were protecting somebody else. There is some data now showing that you actually are protecting yourself as well. So there is less filtration of particles through the mask back to the person wearing it. So the reason for wearing it is to protect yourself, but it's also to to protect others from your excretions. And I just want to point out really quickly before trying to answer this question in more detail that the type of talking or the type of what it is you're doing with your voice and your mouth makes a difference. So singing excretes a tremendous number more particles than if you're talking in a whisper, and shouting is going to be more than a regular voice tone. So those things are actually contribute to how much respiratory particles might be excreted. Now, in terms of wearing it, as I just pointed out, it's not effective if the nose isn't covered. The good thing in pediatrics is we have been truly amazed by the resiliency of children. Children do a really wonderful job with this. They really adapt well to wearing the mask. Most of the, and I think Mrs. Gelders might be able to comment on this being in school. If you see the kids going in and out of school who are required to wear them every day, generally they are doing quite well with them. The myths that I think are out there that are concerning to parents, masks do not interfere with lung development. They don't trap carbon dioxide, so when you're excreting carbon dioxide, when you're breathing, they don't trap it. They actually allow it to come out, and so you're not breathing that in. They don't stress the body or cause weaker immune systems, and they do provide that barrier to decrease spread. So that's why we're trying to encourage everyone, including children, to wear masks. Did I answer your question, or am I missing part of it?
I think that you did. We talked also a little bit about just the type of mask. So things that have single layers are not recommended at this time because they don't filter appropriately.
So generally, the recommendations are you can do a purchased or a homemade mask. It does not have to be a purchased mask. It should have at least 2 layers of cloth, preferably something that's somewhat tightly woven, but there's a variety of cloths that are reasonable to use. It doesn't always have to be a cotton cloth, but 2 layers is important, and 3 layers is a little better if you can. It does need to have a proper fit, so it needs to be able to go over the nose and tuck under the chin in a snug fashion. And it should not have any of those vents on it, because those vents just allow particles to go in and out. So we want to make sure that you don't have a vent on it. There is some very, very recent data saying, we've talked about neck gaiters for over and over and over since March, when we started really looking into this, and initially thought they were not helpful at all. There was a recent study that did show a 2-layer neck gaiter could potentially be effective, and so there is the CDC is looking into that a little bit more, and I think we might see some more information on potentially having 2 to 3 layers in a neck gaiter being a reasonable option. There are face shields as another device that gets talked about quite a bit. The problem with face shields is that, as you can picture it, it's open down here, and so it really isn't the ideal way to protect unless you additionally have a mask. It's great for protecting the eyes from particles, and it's great for protecting the face so that you're not touching something and then touching your eye or your mouth, but it's still not protecting from that respiration of you breathing in and out or somebody else breathing on you.
Sure. So, when talking about masks, one of the things that we hear a lot of times from parents of children with asthma is that because their child has asthma, they cannot wear masks. So, Dr. Kelly, if you could tell us what your thoughts are on that.
Yeah. Any child with well-controlled asthma should be able to wear a mask. And currently at CHKD, anyone 2 and up should be able to wear a mask. There was a group of multi-specialty providers, including allergists, pulmonologists, ENT, neurologists, and all of them felt that wearing a mask was absolutely indicated and should not be limited in any way, except for some patients, and mostly that's limited to where they could not wear the mask. But in general, if you have a feeling that the child can't wear a mask, that they can't breathe or something else, then they probably need to see their doctor and get their allergies or asthma under better control, frankly, because they should be able to wear a mask. And obviously, if anyone's having true trouble breathing, unconscious, then that would be a reason not to wear a mask. But in general, those circumstances are really very rare. And I would agree with Dr. Ramirez that we've seen that kids are absolutely phenomenal, and they will follow the example set by their parents and their teachers. And if these masks are worn and it's just accepted as what we have to do right now, kids are great at mimicking good health.
Absolutely, thank you. Let's talk a little bit about masks in school and childcare settings. So Mrs. Jaildirks, if you could just tell us real quickly, what should schools and childcare settings in general? Dr. Ramirez, do you have something to add?
I just wanted to add, Dr. Kelly and I were both talking about the resiliency of children. There are some things that parents can do that we've seen success with in helping children wear their masks. And maybe Ms. Jaildirks can talk to this as well, being in the school situation. But I think in addition to mimicking it for them, and as Dr. Kelly just mentioned, being a good role model, a good example for your child, other things that you can do, you can allow your child to pick out their masks and take them with you and let them choose choose the mask that they want to wear, let them decorate it, have them put it on and off of a stuffed animal, show them pictures of other children wearing masks, show them pictures of other family members wearing masks. You can FaceTime family members wearing masks or other friends and children who might have a mask on, so that they kind of get used to the idea. And then there are some desensitization techniques that your pediatrician or your healthcare provider can help you with, where you let the child wear it for shorter periods of time at home and get rewards and things that help them learn how to wear the mask for a more extended period of time without the discomfort. The other thing that's out there for some of our children with special needs, there are some creative things for masks right now as well that are starting to come out. For instance, just as a single example, for a child who is hearing impaired, who might need to see lips, there are masks that cover and then have a clear barrier just right at the lips so they can see somebody else and someone can see their lips. So there's a lot out there that your provider can help you with, and there's a lot of resources online that we can certainly provide links to help with that.
Actually, one really great resource is that the Cinch Halo program, which is our healthy alternatives for little ones in preschools, has a mask video out that helps kids to be able to see other children wearing masks and other people, and helps them to understand why they should be wearing a mask. And it's all done really directed to the kids. And I think that they're going to be posting that video in the link below as well. So kind of getting back to schools real quickly, Mrs. Gelders, if you can sort of tell us what are in general schools and childcare settings requiring. We know that, you're speaking more generally right now, not really specifically to your school system, but just really as a school and child care expert, what are generally they required to do?
Sure. But before we do, I wanted to also show there's another one besides for the impaired. There's also an option out there, and I'm not advertising any brand, so I won't say what it's called. However, it's a shield that also is a full enclosure, so that students that are unable to wear masks, or they're not able to see the mouth in order to, if they're hearing impaired, these are really nice alternatives for those students because it's also fully enclosed and it has been approved by the Virginia Department of Health to use in lieu of a mask and a shield combination. So I did want to point that out to let parents know that this is an option. It is available. And we've had some of our parents adopt those as options for their kids that were struggling with wearing masks as we continue to work with them on mask desensitization options. So I did want to just share that real quick while we were talking about options. But also important to note, when we're talking about masks in the setting, during the summer period of time, a lot of the daycares weren't requiring the kids to wear masks because they felt it was almost like a home environment, their own secondary home environment. But now that kids are filtering in and out of the child care settings, more and more have started requiring masks. But more importantly, on November 13th, the governor actually revised his executive order 63 to be exact, which increased the masks where it was 10 and over to children 5 and older to wear masks in school and in the child care settings. It also went to say that indoor places shared by groups of people who are in close proximity to each other, including schools and child care settings. So under this executive order, children are not required to wear masks when outdoors or at recess, for example, but otherwise they are required to wear them in school. It doesn't provide relief for mask wearing mandates for when they're 6 feet or further distancing because they do want the kids to wear them, but it does allow for mask breaks. So kids can actually take a quick mask break as long as they're 6 feet or further apart. They actually recommend 10 feet or further apart. And so kids with medical conditions or disabilities for whom wearing a mask would pose a threat to their health and safety, they can still get the mask exemption. And again, we follow in the Hampton Roads Market the CHKD mask exemption process. So also important to know, if your kids participate in chorus or in band, that the executive order also allows the students to remove their masks when playing a musical instrument or when they're singing, as long as 10 feet of distance is actually maintained. So that's an important distinguishing factor that's just rolled through, that it is an executive order by the governor in order for these students to be wearing masks. Also to note, people question us all the time in terms of what about our preschool kids. The CDC also recommends wearing a mask for students that are age 2 to 4 who are indoors or also in close proximity. So it's not part of the executive order, but we do follow CDC recommendations in our schools.
Wonderful. In terms of airflow being important to reducing risk of COVID in schools and in other places that people gather, like churches and workplaces, can you tell us real quickly, what are a few quick steps that schools or other places may take to reduce those risks?
It's so incredibly important to get as much outside air as we possibly can. So in the school setting, we're actually encouraging as much outside activity as possible. Opening the window to get natural air is a great option and then strongly encouraged. In addition to that, the schools have looked at the ventilation systems to make sure that the ventilation systems meet requirements, make sure that it's maintained on a regular ongoing basis, make sure that the filters are changed regularly and actually more frequently is what we're doing, and making sure that the filters fit properly. Kids that are exercising are going to exert more air, expel more air droplets. So make sure that the kids, when they're exercising, we're making sure they have additional time to cool down when they're exercising prior to coming back inside or in closer proximity to other students.
Wonderful. So kind of speaking about risks, Dr. Ramirez, if you could talk with us a little bit about the holidays. Real briefly, many families are super excited about the upcoming holidays, but with these holidays come gathering, often of family and friends, and we've seen some events in our country become kind of quote-unquote super spreader events. And so, especially with some kids that may not have any symptoms of COVID or only mild symptoms, what should families do related to risk around holidays and gatherings with families and friends?
So I didn't know if that was directed to me or not, so I'll go ahead and chime in. So strict adherence at the school setting, strict adherence to mitigation strategies is incredibly important. That's going to help be the key to prevention of the actual spread of COVID. We work collaboratively with the health department to identify any potential cases so that we can act accordingly. They provide us the guidance, and we're supporting the ongoing contact tracing needs and monitoring adherence to all of that. With the holidays coming around the corner, we're of course on alert in terms of travel. We all know that Thanksgiving has always been one of the heaviest traveled holidays of the year. However, it's strongly discouraged this year to actually travel, and it's recommended that we tighten up what we call is tightening up our bubble. So we want to tighten up the people that we're exposed to, the people we're exposing, and the people that we're going to be around. By tightening up our bubble, we're going to make sure that we stay safe, but also the people around us stay safe as well. People tend to put their guards down when they're family and they're going to family events. Unfortunately, it's the external forces that are being exposed that are most concerning to us. So we don't know what Johnny and Sally have done over the last week while they were in another state. So we're all of a sudden pulled together, and Johnny and Sally may have been exposed, but we're not aware that they were exposed. So knowing that, we have to be careful not to drop down our guard, especially when we're gathering as a family and having with our broader family, including our elderly family, parents, and grandparents.
Great. Dr. Ramirez,
I agree with that, and I would. Oh, I'm sorry.
I was wondering if you had anything else to add real quick before.
I would completely agree with what Ms. Stelters is talking about, and I would say, the short, if we kind of bullet point the recommendations, I would say, if possible, limit your holiday gatherings to your immediate household. If you are going to have a gathering that has maybe family members that aren't part of your household, you want to still try to maintain those mitigation strategies, the 3 W's. And I talk to a lot of children, and I usually do this 1, 2, 3 to form a W. The 3 W's are wash your hands, watch your distance, and wear your mask. And if you can do those 3 things, you've got a pretty good chance of really trying to prevent spread. And then finally, if you're having a gathering that isn't just your immediate family, have it outside if you can. Do your best to be able to be in an outdoor space where there's increased ventilation and less likely to spread it. The other piece of it is, if you do choose to travel and attend a large gathering, you really need to consider keeping everybody home for 14 days after the last time you were with a lot of people in a large gathering before returning to normal activities, so that if there was exposure, it doesn't continue to spread throughout the rest of your community or your school or other places that you're going.
Wonderful. So kind of moving forward with some additional questions. We do have a lot of content to cover tonight, so I know that we've also got questions coming in. So I just want to let everybody know that please keep those questions coming in. If we're not able to get to them directly in something that we cover that we've already got on here, then we'll definitely answer those in the comments as soon as we're able to. So let's talk a little bit about the lingering symptoms, just really quickly. When should a parent be concerned if their child has lingering symptoms, or maybe had a mild case of COVID and then later maybe is showing signs of illness? Just real quick, what are the concerning symptoms that they might want to think about?
Well, I can answer that. There's three things that we're seeing that are potential longer-term effects of COVID right now, and Dr. Kelly, you may have seen some additional things in allergy and immunology that I haven't been seeing. But the first is that there has been some evidence of some potential long-term neurological issues in some people, including some difficulty with kind of thought processing and memory and fatigue, and that's been shown both in some pediatric patients. Not again, these are rare things, but they do occur. Is some we are being very careful with student athletes now when if they've had COVID-19, making sure that they're not having continued chest pain, difficulty breathing. There's something called myocarditis, an inflammation around the heart that can develop. Again, rarely develops, but it can develop, and is certainly something that needs to be followed by a cardiologist and keep a child out of returning to athletics. So children should be evaluated by their pediatrician and potentially referred on if they have had an infection and are returning to sports. Lastly, there's something called MIS-C, which people have heard about, and most people don't really completely understand what it is, including the medical community on some level. It's a rare secondary effect that seems to be associated with COVID-19 called multi-system inflammatory disease in children. And the problem is that you get inflammation of kidneys, brain, lung, heart, eyes, gastrointestinal organs, all different places, without nobody really understands exactly why this is happening. The good news is that while it can be very serious and it can even be deadly, the majority of children who have had this do recover fully afterwards, but it is certainly something that we keep in our mind. Dr. Kelly, I don't know if you have anything else to add to things that we need to watch after.
Yeah, certainly those are the ones that we're concerned about. It's rare, but we have certainly seen them at CHKD. We've had at least 8 children with the multi-inflammatory syndrome. And those usually require hospitalization and observation, but none of those have been significantly ill, and thankfully none of them have had any mortality associated with it. But again, they are something that we monitor for.
Let's talk prevention here for just a second. I know, Dr. Kelly, you've actually been my own son's doctor for many, many, many years now. And one thing that you've always recommended to us, both that he and our whole family get a flu shot. Just what do you think about that? Is that something that, you're wearing the mask? Do we need to worry about flu this year? Or is that something that we should definitely still get?
Oh, yes, you should definitely get a flu shot without question. As we've already mentioned multiple times, you can get flu and COVID at the same time, which would really be a very significant illness with lots of concern for pulmonary symptoms and dehydration and all kinds of issues. And in terms of an autoimmune process, which we think is very active in COVID. So you don't want to get both at the same time. B, as you can see, if you can prevent flu, which has symptoms very similar to COVID, it's one less thing that, one less illness that you have to worry about that would take you to the doctor and make you concerned that you may have COVID, pulls your kid out of school, makes you have to stay home from work, maybe quarantine other family members because you're not sure what's going on. So it really can prevent not only illness in the child, but a lot of other family and social outcomes to keep the child healthy.
So one last question for Dr. Ramirez, and then we're going to look at some of the other questions that are coming in. What about the COVID vaccine? When should we expect one? Should our kids get it? And one of the parents on the line has asked about, when looking at that vaccine, have children been included in those vaccine trials, or only adults? What's the information so far?
So, all very good questions. I mean, as I think most of us have seen in the news, we expect it's coming soon, that we've got two, Moderna and Pfizer, who have both come out with vaccines that are showing 90 to 95% efficacy. They are messenger RNA vaccines, which is a new type of vaccine compared to vaccines that we're all used to, meaning polio and influenza and MMR and all the things that that we are used to receiving. So they're not live vaccines, and they're not actually killed vaccines. They're a little bit different. There are additional companies out there. I believe AstraZeneca, and there's at least one more, who are currently working on other forms of vaccinations as well. The expectation at this point in time is that by the end of 2021 or beginning of 2021, there should, sorry, I said that incorrectly. The end of this year or the beginning of next year, how's that? There should be a vaccine that's available and ready for use. And I have not seen data showing that it's been tested specifically in children at this point in time. I am betting, given the way most things go through the FDA, that it most likely has not been tested in children, or at least not young children. But I'm not. I would be remiss to tell you that for sure. I don't know, Dr. Kelly, if you.
Yeah, no one under the age of 18 has been enrolled in any of those trials. So currently, I don't see an indication for a vaccine in the pediatric population at present. And probably, since they are not a group at risk for significant severe disease or sequelae, I think that those trials will come eventually. But I think the focus right now is going to be to vaccinate high-risk individuals, the elderly, people on first responders, that kind of thing. So I think it'll come eventually, but there's been, all the 18 years so far.
And a lot of the phase 3 trials are actually focusing on the elderly population, and a number of those with secondary conditions that can contribute to their morbidity and mortality, such as obesity and diabetes. So I agree with Dr. Kelly in that I don't see that this is going to be widespread use in children to begin with. I think that will come later.
Okay, great. Well, we are just about at time right now, and so we are going to try to answer some of those questions that are in the comments later. But what we wanted to do is, there was one question that came in that was asking about some of the differences between very young children being in school and older children being virtual or in hybrid. And what's the difference, and why are the younger kids able to go back, and why are the older kids staying home?
I can speak to some of that on this, being on the school reopening task force. There are several pieces to this. So first of all, we do know from the data that's been collected that children under 10 tend to have, or 10 and under, I should actually say, tend to be less likely to spread the disease and less likely to have significant sequelae from COVID-19. So in terms of the spreading piece, if we have these children back in school and they're less likely to spread it, then we are, feel more comfortable that we're not going to infect the teachers and the staff and all of the other people that, that are also giving their time and putting themselves in a somewhat, putting themselves at some degree of risk in order to be back in that situation. Secondly, our younger children are the ones who have the most at least from what we've seen so far, have the most negative impacts of not being back in school. And so our youngest children are the ones that a number of them rely on school for things way outside of just education or just, classroom education. They rely on school for food. They rely on school for mental health support. They rely on school for sometimes for identification of medical problems. The families rely on school as a means of childcare that doesn't cost. And so when the parents are trying to work, so there's the negative impact of the younger children not being back in school seems to be larger than the negative impact of some of the older children not being back in school. That said, the ultimate goal of the American Academy of Pediatrics, the goal of the Virginia Department of Health, is to get all of the children back to school and to not have to use hybrid situations. But we only do that when we think that we're in a situation that's as safe as possible for everybody involved. We certainly don't want to put teachers or anybody else who's in the school system at risk in doing so. And so it's a little bit of a balancing act. And I think as we gain more knowledge, we're going to be able to make more rapid decisions and more concrete decisions about what to do. Right now, we're looking at things such as the viral, how many cases per 100,000 in the population of each city. We look at what the percent positivity rate is for tests that we're looking at, but we're starting to see that maybe the mitigation strategies, the mask wearing and the distancing is really working, and it might actually be a lot safer for everybody to be in school than what we were initially thinking.
Well, we're going to go ahead and wrap up here. I know that there are a lot of questions that are still there, and I want to let everybody know that we're going to take a look at those over the next couple of days. So probably won't answer those tonight. I think we're all ready to get back to our families, but definitely we'll try to get back to the ones that we didn't cover in this webinar, and perhaps maybe we'll look at some additional webinars since we had so many questions coming in. I did want to say thank you to all of our speakers tonight, Dr. Kelly, Dr. Ramirez, Mrs. Gelderts. Thank you so much for coming and talking and chatting with us. Also wanted to thank our planning team and everybody behind the scenes. A lot of times we forget that although the experts get to talk up here, it's really this big team of people. It's a community doing things behind the scenes that help us to be able to spread these messages, just like it's what you all do at home around wearing your mask and distancing and washing your hands that helps keep everybody safe. But I did want to take a moment just to thank our IT team here at EVMS Live for all their help, as well as our marketing communications department. And just a really quick shout out to Nancy Chapman for marketing communications. She has been our representative for pediatrics for years and years and years. And this is her last event here at EVMS. And so I wanted to say thank you for your service. You have helped to deliver our messages and to save lives and keep kids and families safe and healthy. So Nancy Chapman, thank you so much for all your years of working with us. That said, thank you all the parents who